Hi, my name is Samuel Mujisha, representing team TatuNurse. Tatu is a Swahili word that means three. We boost the performance and efficiency of nurses in developing countries by at least 3 times. That means that for every nurse, for instance, in Uganda, you get 3. Our mission is to make the nurse smarter so they can save more lives. Meet Sister Proscovia.
Namiro Proscovia, nurse who has worked for over 25 years. My day really starts as early as 8 a.m. where I come on ward and I have to get a report from the outgoing shift, and in that report it is both verbal and written. After that we do a quick ward round, ward round for the nurses to look out for who is very sick, where are going to start from. Then we do ward organization. Organizing the ward, I will mean you prepare whatever you want to use with patients. You try to clean up your area so that you work in a clean environment. Then you go down to do vital observations on these patients. Doing vital observations on these patients also has challenges because, for example, on certain days, my ratio is between 40 and 50, one nurse to handle 40 patients. And to make the work worse, the moment you are doing observations, then other emergencies will come in. So you find that work is half done. Ideally, if I had 4 patients to handle in a day, then that would be okay. Also along that day, there are treatments time. Certain patients are supposed to get treatment at 10, another will get at midday. So you may even forget since you are alone. So you find the whole day the nurse is stressed, resources are not available, has to be in patients 24/7. You have no time for yourself. We get backache. The stress itself affects us. There are also major effects on the patient. 1, the patient has not got exactly what this patient is supposed to get. The drugs are not given in time. You've not assessed fully this patient to identify other causes of the illness. You've not had the time to teach this patient how to care for themselves, like in preventing diseases or what. We are supposed to help educate these patients. But since we are having so many patients, you are going to discharge this patient with malaria, for example. Next, after 2 months, the patient is coming back with malaria because you didn't give the basics of how to prevent malaria.
TatuNurse is a mobile phone application that enables nurses to become smarter by providing nurses with the right information at the right time. This improves the efficiency of bedside monitoring. TatuNurse bears an electronic task manager generated every morning by patient intake information and adjusted by nursing staff. This is key in prioritizing patients and tasks, ensuring that those who need emergency care are attended to immediately. TatuNurse offers clinical decision support by integrating specialist protocols such as the emergency triage and assessment tool ETAT. This enables nurses and doctors to generate accurate diagnosis quickly. TatuNurse then automatically sends alerts in the form of personalized messages and automated calls to nurses about actions to be taken concerning a patient. These alerts are flagged continuously and escalated to the other clinicians on duty until the issue is addressed. TatuNurse supports robust capture of vital signs. At the moment, nurses have to manually take all vital signs and record them on paper. TatuNurse application will be interfaced with triage devices such as the pulse oximeter to automatically capture pulse and oxygen saturation. This will save nurses a lot of time. The patient vital signs are then graded using early warning scores based on the World Health Organization protocols to flag patients as green, yellow, or red for normal, priority, or emergency respectively. This information is displayed on a TV dashboard. This facilitates communication between clinicians and makes handovers seamless. TatuNurse supports rapid identification of patients using barcode technology to create a barcode wristband that is attached to the patient during their hospitalization. This is key in fast identification of patients. Over time, data captured by the TatuNurse application will be analyzed using machine learning algorithms to detect and predict when a patient's session is going wrong and alert clinicians in charge. Predictive information will be key in ensuring that care is given prospectively rather than retrospectively, hence improving the quality of care. There is a huge market opportunity for TatuNurse all over Africa. In Uganda alone, there are more than 6,000 health facilities. These are government, private for-profit, and private non-for-profit. Of these, 28% have inpatient wards and are primary targets for TatuNurse. There are also 44,009 nurses in Uganda and 42 million people, all of whom are our target market. To penetrate the Ugandan market fast, we will offer a premium version of the TatuNurse application with a few features such as educational resources and continuous professional development CPD calculation for nurses. This will be offered for free. Hospitals will pay monthly subscription fees ranging from £70 to £1,300 depending on the number of users at the hospital. There will be a version for patients that will enable patients to access the medical records on their phones, treatment plans, follow-up information, etc. Patients will pay an annual subscription fee of £2 to access the application. We also make money from data analytics. Researchers and implementing partners will pay fees to access this data. This will be negotiated depending on the requirement. These revenue resources will give us enough money to be sustainable as a non-profit organization. There are solutions developed in the UK such as Send and Reads Africa. These are not customized to the local resource-poor settings in Africa. They rely on internet, which is not usually affordable or available. They are also too expensive for Africa. 98% of the nurses in Uganda still use paper and pen. We have a multidisciplinary team that is committed to solving the challenges of nurses. I graduated with a master's in advanced computer science from the University of Manchester in 2018. I have 8 years of experience building and implementing health applications in resource-poor settings. My colleague Patience Nagawa is a current student at the University of Manchester. She is pursuing a master's degree in communication and signal processing. She is passionate about the Internet of Things, wireless communication networks, and machine learning. She works as a hardware and device communication engineer on the team. Lydia Mbazira holds a bachelor's degree in accounting and finance and is a current student of ACCA. She is the finance manager on the team. She has 3 years of experience in grants and finance management. Philip Nomwesigwa is a senior enrolled nurse at Church of Uganda Chisizi Hospital. He has experience of 4 years. He provides clinical input to the team. Earlier this year, we received a grant from Bra University of Science and Technology in collaboration with Camtech Uganda. This is enabling us to build and complete the minimum viable product MVP. We hope to begin a pilot implementation at Mbraya Regional Referral Hospital with your support. Earlier next year, we hope to launch and begin marketing the application in Uganda. We will then aim to scale the application all over East Africa in the coming year. We hope to market the application through medical networks and nursing associations such as the Uganda Nurses and Midwifery Council, Uganda Protestant Medical Bureau, Ministry of Health, and other organizations to market to hospitals under their cover. We also hope to set up the TatuNurse Advisor Program, where we will train and certify volunteers to market and run the implementation of TatuNurse at their hospitals. The £12,000 will give us a huge boost. It will enable us to empower at least 400 nurses in Uganda. It will also enable us to enhance nursing care of at least 1,000 patients in Uganda. We will use most of the money to do a pilot at the Regional Referral Hospital. The rest of the money will contribute to our marketing, human resource, publication, and completing of incorporation. TatuNurse, make the nurse matter, save lives.